and then the Zoom woman tells you that this meeting is being recorded. So please do make comments in the chat. We've got a space to ask questions after John has spoken, and we're going to go into some smaller groups to talk about some of the things to do with the centre, so hopefully everybody gets a chance to speak. If there is somebody you really want to be in a breakout room with, will you make sure you tell me in the chat, because I'll have a go at trying to make sure that that happens. And the other thing is, we've got the live subtitles on from Zoom, so you can see them along the bottom of your screen. They're not brilliant, but some people find them really helpful. If they bother you though, you can also turn them off if you look along the bottom of your screen. I think I've done everything on my list. I think. So I'll hand it over to Jack, who's chairing today's session with us.
Hi all, and welcome to this session about impact social support. It's very nice to have you all. I'm Jack, as Sam said. I am a sales advocate on the representation .LD, and I have been in that post for about 6 months now, give or take, and I am thrilled to do this with you. So, what they're doing today is they got John on Impact to talk about social support and why it's important. So they are running this session because on understand LD think social support is really important, and that like e.g. the centre members the LD think that social support is the life and not a service. So as they see on the screen now, there's the diagram to illustrate the point that I said. Now I could talk and ladle on and on about it, but I don't think I'm the best person to do that. So I'll hand over to Sam again to explain.
Thanks, Jack. I just realised I was on mute. I know, I'm so sorry. We just wanted to share this graphic again. That was the graphic that Penn made after the lots of work with Learn to Speak England members, because it reminds us of why the work of the Impact Centre we think is really important to lots of Learn to Speak England members, because the Impact Centre is wanting to start with what's important to people. And what we heard from members was about start with human rights, equality, support people to live a good life and really be connected to their community, not only have really good formal support. And the really good formal support matters, but it isn't the whole thing. It was about a life, not a service. So that's why we were so excited to be connected to the Impact Centre and be able to try and tell you as Learn to Speak England members what it's about, because we think it really matters. So I'm going to hand over to John now, I think.
That's great, thanks. And hello everyone, and thank you for inviting me to be here. My name's John Glasby, and I work at the University of Birmingham. I trained as a social worker before I worked at the university. I'm now the director of Impact, a new centre that's just been set up to get evidence of what works used in adult social care services. And Sam and Jack very kindly given me this opportunity just to explain the centre to you a little bit, to introduce it, and then to see if you had any questions about what we'll be doing. We wanted to ask you some questions that would really help us in our thinking, so that we use the money that we've received really well to make a difference. So let me just try and share my screen. Can I just check, can people see that now?
Yeah, I can see that, John.
Brilliant, thanks, Jack. That's great. So our centre is called IMPACT, which stands for Improving Adult Care Together, and it's funded by the Economic and Social Research Council and the Health Foundation. And our belief, as Sam was saying, is that, as it says at the bottom here, a quote from somebody who was drawing on care and support and contributing to our centre, who said, good support isn't just about services, it's about having a life. So it really is very similar to that vision that you drew out with Penn as part of the Social Care Future inquiry. Some of my details are just on this slide, if that's helpful. We, the Impact Centre, wants to make social care services better across England, Wales, Scotland and Northern Ireland. And by helping those services to be better, to make a difference to people's lives. And those funders that I mentioned have given us £15 million over the next 7 years to try and find out what works well in adult social care, and then to help other areas to adopt best practice. So it's an evidence centre, if you like, trying to understand what works and then helping other areas of the country to adopt those ways of working. We've been asked to set up and then run this centre with 3 phases. So at the moment, we're in our first phase, which the funders describe as a co-design phase, when we're talking to people across the whole of the social care sector in all its diversity about exactly what we should do, how we should spend that money, and how we should work with existing organisations and partners. And we're trying to make sure that we hear from as wide a range of people as possible, so that the centre's work really makes a difference to people's lives. Just to give you an example, one of the things we're doing at the moment is an online survey, and I'll share details of that later. It's been completed by about 2,000 people so far across the UK, including lots of people who draw on care and support, lots of families and carers, and lots of frontline practitioners, people who often don't get asked when these kinds of centres are set up. One of the things that we really want to do with the centre is focused on evidence of what works, and we want to make sure that that we draw on quite a broad definition of evidence. Some people, when they talk about evidence, just mean research, but we mean different types of research. We mean people's lived experience of drawing on care and support, and the experience of carers and families. And we also mean the knowledge of social care staff. And we think that all 3 of those things are important: research, lived experience, and staff knowledge. And that we need to listen to all 3 of those voices if we're going to make a difference. And our experience is that's not always the case, that often people think research is important, but they don't think that lived experience or staff knowledge is as important. And we think that's wrong. Our definition of evidence will draw on lived experience, staff knowledge, and research when we're trying to understand what makes a difference to social care services. As we've been talking to people across England, Wales, Scotland, Northern Ireland, and beyond, actually, people have told us what they think might help to make a difference. People have said what they would really like is some practical help with our local services to try and change care for the better. So rather than being a university that just tells people what they ought to do, we should be working alongside local services to give practical help and support to work with evidence in the reality of frontline care and the reality of people's lives. Part of that will be making sure that we support the involvement of people who draw on care and support, carers, and then also often low-paid care workers who will be crucial to the success of the centre and who have to be involved in all aspects of our work. And we have a national lived experience engagement lead at the moment who is working with user and carer-led organisations across the country to advise us and support us in terms of our approach to co-production and lived experience within the centre. We also think that adult social care is very fragmented. There are lots of different groups of people, all with their own ideas about what would make a difference. And there aren't many shared spaces where people can come together to talk to each other. And we want Impact to bring people together from different parts of the social care system, people who use services, carers, practitioners, service providers, commissioners, researchers, and others, so that people are working on common problems and hopefully on common solutions. And we know that some people will need support to do that, and that we also need to work really hard at being inclusive and making sure that we communicate well so that everyone can take part. If people want to contribute directly, you could complete our survey. It's available in 7 different languages and in an easy read format. And the link in the slide is the easy read link from memory. That survey finishes soon on the 8th of October, so you've got a couple of weeks to fill it out still if you would want to. People can do that themselves. It takes about 10 minutes online, but they can also do it with help from somebody else, from a friend or a family member, or perhaps from a support worker. And people can do it as a group as well. So a group of self-advocates meeting together to provide peer support to each other could do it as a group and then submit the survey. And that survey will really help us to decide how to spend the money so that we make as big a difference as possible. So please, if you do nothing else as a result of today, please complete that survey. And Learning Disability England has already been fantastic at helping us with that and sending it to all its members and encouraging people to take part. As I said, we've had about 2,000 people so far, and we'd love more people to contribute. And at the moment, we're in our design phase where we're talking to people about what would work best. Next year, in 2022, we have what the funders are calling an establishment phase, where we will be getting set up. And then from 2023, we will have 5 years of delivering projects. And we're suggesting 4 different types of projects that I just wanted to describe to you really briefly now. And then in the groups afterwards, get your ideas and your advice about what would work. So first of all, for really big long-term change, we're suggesting some demonstrator sites where 2 people, one would be experienced in managing change, and one might be somebody who draws on care and support, or somebody who works in frontline care settings. Those 2 people would work together with a local service for 18 months to help them introduce an evidence-informed change project. They'd help that area to carry out an evaluation of what works, and they would also use those lessons to try and influence national policy. So just as an example, if the topic was, how do you help those 2,000 people still living in long-stay hospitals in England come out of hospital and lead more ordinary lives in the community? If that was a topic, our 2 people, coaches we might call them, could work with a local service or a local system to try and bring about evidence-informed change in that area. And they would also be working with national policymakers to try and share learning. So they could work with the Care Quality Commission to try and change the way that we inspect long-stay hospitals, or they could work with universities to try and change the social work curriculum so that we train social workers differently in future, or they could come up with a new type of service that might help people to lead more ordinary lives, or they could do all of those things. So quite big long-term projects that try and get a big change carried out in a local area, but then try and share that learning nationally. Our second model then we're calling impact networks. For more practical problem-solving issues, we might set up, let's say, 10 or 12 networks across the UK, all working on the same issue in their locality. Those networks would be made up of service users, carers, practitioners and managers, and they'd meet together, perhaps over a 6-month period, to make some positive changes in their local service. They'd get some evidence and some help from us to start them off, and some participation costs and so on. And after each meeting, they'd send us a summary of what they'd been doing and what they'd achieved. And we would put that together and then send it back out to all the networks across the country, so that you had these very local groups working together on practical actions, but that you had some sharing of experiences across the UK with different groups. A third model then, we've called impact brokers, and I don't really like this term. I'm hoping we'll find a better one. But that's where we might put somebody from our team in a local organisation to carry out a smaller change project, perhaps to work with them over a year to make a practical difference to that service, and then to share that learning more generally. And then finally, through our website, we're exploring what we're calling an Ask Impact service, where people could ask us questions on things that they're finding difficult, or challenges that they've got, or opportunities they've got. And we could put those together, and where there are some common questions coming in, we could then provide accessible information about the evidence base to help people with their queries. And that service might help us to understand more about what's going on around the country. But it would also mean that we were providing accessible evidence to people to help with their practical questions. And some of the co-production networks that we've met as part of setting Impact Up have said that they might find that particularly helpful, because it's very difficult to know what a good service looks like or what the evidence says unless you've got really accessible information to help you understand. So could some of that accessible information help people locally challenge public services if what they're getting isn't right, or hold those services to account by giving them some practical material to help? So those are 4 of the models that we're thinking about: demonstrators, networks, brokers, and Ask Impact. And in a moment, I think I'm going to hand back to Jack and to Sam to see if there are any questions that I can answer just about the centre generally. But then there's likely to be some small group work where we ask you a couple of questions. And I suppose what I'm interested in really is, are these good ideas? Will they make a difference? And in particular, because lots of people seem to think that these probably are quite good ideas, but in particular, do you have any advice for us as we're trying to set up those 4 ways of working? I suspect that the people on the call will have experience of some similar things in the past, or will have some ideas about what would make a difference. And if we were working on those 4 from the previous slide, what advice would you give us to make sure that we do it well? Those are the questions that we wanted to ask. So if it's okay, Jack and Sam, I'll pause there and I'll stop sharing my screen so that I can see the chat again, and I'll hand back to you two for the next part of the session.
Thank you, John. I think we had some problems with your sound there, but I hope most people heard it. There are a couple of things in the chat. We've got no questions. Oh, yes, we've got the first question from Annie in the chat, which asks, will these 4 approaches include everyone, even those in more marginalised groups who often don't have a voice?
Yes, I'm sorry if there were problems with my sound. The problems of sharing your slides is you just see you're not picking up on people's videos or on the chat. So if that was difficult. Yes, we've got 4 things that we're trying to take into account when we decide what topics we work on. One of them will be making a really big difference to people who use social care. And that could be making a difference to a big group of people, or it could be making a really big difference to quite a small group of people, perhaps groups that are really marginalised, but who would really benefit. So making a difference is one. Number two is tackling inequalities. So that really is about the marginalised groups that you mentioned. And then number three is about making good use of resources. And that doesn't just mean money or council's money. It also means the skills and connections that we all have, and the communities that we live in, and the things that we're good at. Those are all resources too, as well as the money that councils spend. And then number four is just things where evidence might be able to make a difference. So we're definitely keen to focus on marginalised groups and tackling inequality. We've also worked really hard with our involvement mechanisms to make sure that we hear from a really wide range of people, including people who have care and support needs, but who aren't getting social care support at the moment. They might be funding their own care. They might not be eligible for services. They might be getting help in their local communities rather than from their council. So we've been trying to include quite a wide range of people as well. And we've focused in particular on trying to understand the experiences of people from Black and minority ethnic communities, given there's been such discrimination against some of those communities as well. And our lived experience engagement lead is working with a series of community groups that work with people with seldom heard voices to make sure we get better at hearing those voices.
Okay, thank you, John. I just saw a thumbs up from Annie, so I don't think she's got a second quote. I mean, I guess from my point of view, I was listening to you thinking, how do we make sure that the people who don't use words to communicate are in this thinking somehow? And that's something that maybe all of you, I was about to use we in the broadest sense, hoping all of you, but others as well, might help make sure that's connected to the centre. And it sounds like you're open to that, John, you know, from what you're saying very much. So
really open. So different projects, I think, would be working on different topics. So they might have to put extra things in place to reach particular groups of people. And then we've been trying to hear a range of different voices, including from people who communicate in all kinds of different ways. So just as an example, so that people know, one of the mechanisms we have is a series of 5 assemblies, one for Wales, one for Scotland, one for Northern Ireland, and 2 in England. And each of those are made up of about 30 people. And they're people who draw on care and support, carers, practitioners, providers, commissioners, researchers, and national organisations. And we've been working really hard to make sure that those are very diverse and very inclusive meetings, and that we've been working really hard at the facilitation to make sure that everyone feels comfortable contributing their views. And some people feel comfortable doing that as part of the assembly in the meeting in small groups. Others would rather just watch and listen to the conversation, and then would rather send in their thoughts to me afterwards by email, for example. And they might have a friend member or supporter who can help with some of that. So we're trying to emphasise that we all communicate in different ways, and that everyone's contribution is important, and that we need to work really hard at hearing different voices, and that there are some voices we need to work even harder to hear, and that's a really important part of the centre.
Brilliant, thanks, John. And I've just got a couple of other questions. Oh, go on. Sorry, Jack, were you just going to do them? Sorry.
I was just going to say, I'm sorry, son. I realised, because I was beginning to say something after John, so the third time, though, I realised I was on mute. So you couldn't hear me. So sorry like that. I lost paying attention, though.
I'm sure. Well, one of the questions we've got is Kevin Rogers has asked, will you have like quality checkers to make sure that like social care for people with learning disabilities is happening in a safe and good way? And, you know, is there a whistleblowing policy if abuse happens or those kind of things? Have I got that right, Kev? Is that what you were asking? Yeah.
Yeah, I'm asking that. Yeah, that's it. That's right. Yeah.
Yeah,
Yeah, that's
great.
it. Yeah.
It's not quite the same as quality checkers, Kev, I guess, but where we've got our staff going into services or local areas to run projects, we'll have a system in place so if people see signs of poor care or abuse or neglect,
also money, financial abuse as well.
Yeah. There'll be a mechanism for a mechanism for raising that. So with our research that I do at the moment, we have a system where things that people tell us are confidential, and if we write about them in our research reports, we change people's names so that you can't tell who it is.
Yeah, security.
But if somebody raises a concern about abuse or neglect, then we have to raise that concern. So we tell people in advance that those are the kind of rules, if you like. So this isn't a research study, it's different, but we'll have the same mechanism in place. If we see something that's abusive, then we'll raise it as a safeguarding issue in that local service. We have a duty to do that. We couldn't keep quiet. What will be harder, I think, is if we see poor care or care that isn't good enough, but that perhaps isn't quite bad enough to be abusive or neglectful. And so we'll have a dilemma about how do we work with that local area on some of those issues? How do we talk about it and how do we raise those concerns? But we're definitely very aware of that issue. It's a really good point.
So can I just check? That's really helpful. So Karen asked about people with learning disabilities in the criminal justice system, and also Annie asked about is it a single project under all of the ideas, or could there be several, under the different ways of working? And I'm kind of keen to get everybody in groups in a minute. That's why I was just grouping those. But also then finally, before we go into smaller groups, so you can all have a good chat about it, Sarah asked how many, to get an idea of the scale, how many staff does Impact have?
Yeah, those are all great questions. Yes, if we end up, it depends a little bit on the topics we end up working with. But for example, at the moment, I'm running a research study in a different hat about the experiences of people with learning disabilities and autism in long stay hospitals. And that is including lots of people who were in those settings having come via the criminal justice system, and lots of issues about how health, social care and criminal justice work together. So we could well have some projects that have that as part of them. For our work plan, we're just agreeing that with our funders at the moment. We may know more over the next few months, but we're expecting that there'll be a number of projects under each theme that we take on. If we took on a theme of person-centred support and asset-based approaches, to use the jargon, we might then have a number of projects under that theme with a number of those delivery models in different parts of the country. And at the moment, the centre is really me, a centre manager and a project officer, with a leadership team of about 12 or 13 social care organisations and universities. Organisations like BASWA, Carers UK, TLAP, Sky, Skills for Care, if some people are familiar with those organisations, plus 5 universities across the UK. We're just trying to put together our staffing for next year, where we'll be running 4 or 5 projects to test out those different models. And then from 2023, we'll be a lot bigger when we're running more projects in more parts of the country, all at the same time with more staff. So that's a really brief answer, Sam, if that just helps to...
No, that's great. Yeah, thank you. Thanks, John. If people are all right, we'll have some more time for some questions, but I was going to suggest that I give you a chance to have a chat to each other. Now, one of the things that Cindy asked is if you could see the slide again for the 4 options. So just before we go into the groups, John, are you able to share that slide on the screen again, just so that everybody sees them? It's always mean of me to do this, isn't it? When John thinks he's finished his presentation, So, So the questions are these good ideas? Will they make a difference? Do you have any advice for the centre? And the things that they are, Jan's going to put those in the chat, I think, but can we have the 4 things? That's it. So the demonstrator sites, having networks across an area that will bring together people working on an issue, having like brokers who might go and work with a local organisation to do something to help make change, and then having an ask impact option where people can go on the website and say to the impact centre, what about this? You know, we want to know about this. So they're the things that John's kind of asking us to think about.
Yeah, yeah, like, I agree with Sam. I think it's time now to go into small groups and think about these questions.
Great. So shall I open the room? So you'll all get a room that I'm sure you're all very familiar with, join breakout room, and I've set it for 10 minutes. So we'll see you in about 10 minutes, but do come back and feedback after that. Thanks.
Okay.
Welcome back. You were very prompt. I think the others are going to hang on till the very, very bitter last second, you know.
They're obviously saying a lot then.
Yes, yeah, obviously. Yeah, yeah. I wonder if John feels like it's his interview all over again, the group he's in. You know, that feeling of, and what about this? What about that?
Sam, is this for the whole of
Yes.
adult
Yes.
social care? It's
Yes.
not just learning disabilities?
No, it's for the whole of adult social care, yeah.
Wow. Okay.
But that's why I guess why we're so keen to make sure that people with learning disabilities and their families and their experiences, their supporters are included, you know. So
15 million isn't really a lot for England, Wales and Ireland, but
oh well, yeah, John might have a view on that. Yeah, he's smiling, giving you a thumbs up, Mary. I don't know whether you saw that.
Yeah, well, yes, Mary, I just came in on that. It's really hard, isn't it? Because it's such a lot of money, and it's so fantastic, and it's a once in a generation opportunity to make a difference. You know, social care doesn't normally get this kind of money, so the funders have been amazing, and yet 15 million over 7 years, over 4 nations, in a sector that's got so many challenges. You know, that money won't actually buy very much over that period of time, even though it sounds churlish to say it. So we're going to have to be really realistic, and we're going to have to work with lots of other people to make sure that we're all trying to do it to make a difference, because there's only so much we're going to be able to do but by ourselves. So I've got the strange dilemma of lots of ambition but lots of realism, and lots of money but not very much money.
I see.
Yeah, thanks, John. Oh well, Karen's got her hand up. Karen, do you
I just want, because Mary, we talked about this in our group, didn't we, Mary? You're quite concerned about it, and it's going to spread thin. But I think the bit really is that organisations, I'm from Keyring, but we all have a part to play in this. We can help spread the money further by contributing and taking part and just helping out wherever we can. Because if we don't do that, it isn't going to go anywhere. You're not going to be able to fund every single thing. But actually, there's a huge amount of people who could, you know, volunteer, contribute, do something that will help it come to fruition. It's incredibly important, I think, this opportunity, that we absolutely make the most of it.
Great, thanks, Karen. I'll just check. Kevin, 15 million for the UK, is it, John? It's 15 million for the whole of the UK, not just England.
Yes, it's the whole of the UK. It's 15 million. It's 7 years, and it's the whole of adult social care, not just services for a particular group. So one of the things that we want to do is to focus on some themes. So if we focus on prevention and well-being as a theme, and if we focused on person-centred support as 2 examples, we might run projects in different parts of the UK on those, and then with different in different service settings. So one might be for people with learning disabilities. One might be for people with dementia. One might be for younger people with a physical impairment. One might be for young carers, say. And we'd be looking for lessons that we could learn across those different settings to try and make sure that the centre was greater than the sum of its parts, that it could share learning. Otherwise, all we'd have is a series of interesting projects that would stop when the money stopped. That's the problem with projects, isn't it? We've all experienced that. So this has to make a bigger change than just the individual projects.
Thanks, John. Thank you. Now, I failed in my role, Jack, didn't I? I was supposed to say, will you make sure any advice for John you capture and we can put in the chat? So we give him the chat afterwards, or we copy and paste that out. So if any of you in your conversations had like, oh, please don't do this, or please do this, if you could make sure it goes in the chat, one of you from your group, that would be really helpful. But go on, Jack. So I realised I'd messed up. So go on, I'll go back to you.
No, yeah, I'd forgotten about that too, so don't listen. I just got a question from Annie to John. Is this work across the whole of social care and not just about disabilities?
Across the whole of adult social care, yes. And we, because our vision is that good care isn't just about services, it's also about having a life. We want to look at adult social care in its own right, but we are very aware of linkages to things like health and housing. Someone else mentioned criminal justice earlier as well. And also the transitions that people go from youth services into adult services. So it's focusing on the whole of adult social care, and we want to do justice to adult social care in its own right, because it so often gets neglected and forgotten about. But we don't want to neglect the linkages with other systems and other services, because they're an important part of us all having a good life together.
Yeah, thank you, John, very much. Now, I'm very conscious that this person had a hand up earlier but didn't get a chance to talk. So, Cindy, I hear you got your hand up.
Yes, thank you. That's great. Yeah, John, really interesting to hear about everything. I suppose, as you rightly say, 15 million doesn't go a long way, particularly over all of social care. I suppose just from my perspective, and we did talk about it in the group, was it's great the 4 areas you're looking at, but I suppose I would like to see more specifics. If we're looking to make a real change and a real difference, I think we know where the areas are that impact across social care, and how can we go ahead and address those areas. So we're talking about recruitment and retention of social care staff. It's a sort of a real issue across all local authority areas, across those older people, learning disabilities. Housing is another key area. I suppose from my perspective, it'd be good really to sort of the money be spent on something that's going to deliver real change for everyone. I think we all know what the issues are, and it's how we address those. But the other thing is absolutely the focus on people in hospitals, long-term hospitals, coming out into the local communities, and that's great. But what about services in the local communities being able to support those people, but also people currently in local services? There's significant gaps in service, and that's a real thing. And there was a really good comment by Tony in our thing about how you advertise the work of impact. And maybe I hand over to Tony and Angela for that.
You might have to bear with me.
I put something in the chat, Tony. I put something in the chat about that to try and summarise it. Is that all right? Did you see that?
Yeah, I did, Angela. Thank you. So we mentioned on how to make the most of several social media platforms such as Facebook, Twitter, even Instagram to a certain extent. So Impact's work could reach out more to like to people who might not even be members of Learning Disability England and beyond even.
Brilliant, thank you, Tony. And I think we will, we'll, like Angela's put it in the chat, and we'll make sure it goes. I'm just really aware of time.
I am
Jack,
too,
do you
yeah.
know who had hands up next? Was it Mary or was it Ash?
It was Nelly that had her hand up next. So, Nelly, if you want to answer your question or your comment?
This 15 million, it's for it's not just for the UK, it's for Ireland and Scotland as well, isn't it?
Northern Ireland, Scotland, Wales.
Yeah,
isn't it?
Oh, wow.
Yeah, for Wales, Scotland,
Republic
Northern
of
Ireland and England.
Republic of Ireland
Yeah.
separate countries in the EU. Republic of Ireland, Northern Ireland's in the UK, and Scotland, and Wales, and England. Wales, England, and Scotland, and Northern Ireland, UK. Yeah.
I see.
Yeah. Is that your question, Nelly? Done?
Yeah. No, that's sorry.
Yeah. Okay. Tash,
Right,
and then
mine is quite similar to what was mentioned before, but it's more like if people really cannot communicate who are autistic and they're non-verbal, and they communicate with Mataton, or they have to communicate with the spelling board or with the soundboard. How would you make sure they're always included? And also, for people like me, sometimes who are too proud to go for help, you have to make sure there's somewhere available that we can go for help if we need it as well.
Yeah, there's some great comments and questions there in the chat, and I've just put the website, which has got more information and contacts. People can fill out a survey there, and they can sign up to receive updates as well if people want to follow up things from today. Yeah, I think how we communicate and how we work with people will be crucial. And on some of our projects, we can do that directly, where we can work in accessible ways. With some of our national communication, we can make that as accessible as possible through all the different channels that people have mentioned. But also, we're a little bit reliant on our partners to spread the word and to speak to their audiences. So Learning Disability England have been fantastic at helping us and promoting us and organising today. I've had great conversations with the Alzheimer's Society. I met all the chief execs of the disabled people's organisations, some of the centres for independent living around the country who were promoting this. An organisation called Pendrell's Trust that supports a lot of personal assistance, information about impact and its survey to all the personal assistants that they work with around the country. So in one sense, we're a little bit like a network of networks where we're working with our partners to try and reach as far and as wide as we can. That has to be quite generic, that there's only so much we can tailor it. But when it comes to individual projects where we're trying to speak to particular groups, we'll have to be very sensitive to how we work. So on my long stay hospital project at the moment, we're working with people who don't communicate verbally. We're working with people who have a label of behaviour that challenges services. We're working with people who are in seclusion. We're using talking mats. We're doing stuff, through art and other ways of communicating to try and build relationships. So some of our project work will have to be very innovative about how it operates, and some of our national communication will have to be as accessible as it can be, and then to work with different partner organisations to spread the word. So everyone here today, if you can go away, look up a bit more about impact and tell people about it, that would help to spread it again from us to Learning Disability England, to you, to your networks, and then that's how it grows and how it spreads.
Yeah, I was just thinking, and I quickly, because they don't know at the time, though, I was just quickly, Sam, could they put it in our newsletter?
Yeah, no, we have a few times. It's been in a couple of times, but we'll keep sharing things. And we've had this session with John, and I'm not committing, John, but if there was a chance to catch up and talk again when plans have moved on, we'd hold another. Do you know what I mean?
Definitely.
But, you know, didn't want to plan John's diary for him for the rest of his life, but but you know, we would do that. So we're really up for doing what we can to help all of you be part of this or contribute in the ways that you want. And I think Christine put in the chat to make sure that small, creative, local organisations are connected, and not only the people that are easier, the bigger organisations that are easier to find. And that's why I'm really pleased that some of you are here, because that can be the beginning of, like John says, us networking and just connecting people. I know lots of people have to go to other meetings, so shall we finish there? But we will send you links out, and you can let us know if those don't answer questions for you. You know, we'll send you everything out.
Yes, and if you're unhappy about today's session, the lane's sand, not new.
And on the note of solidarity, kindness, and positivity, thank you all so much for coming. I hope it's been useful. We will ask you for feedback when we send the stuff.
Sam, I couldn't get the link for the survey, so can you send it to me? Because I can't do chat from my iPad.
No, not at all. I mean, yes, of course, Tasha will. I promise I'll get it to you. That I'll drop it on an email to you before I forget now. But we'll get you all the recording as soon as we can.
All right. Thank you so much.
Thanks, everybody.
Thank you.
Bye.